needs for this patient.
Very good.
Well, I just think that it's important to get the right access points in the community for it. I mean, I envision, and I get accused all the time of thinking big and dreaming, and that's what I do, and then I try to go make it happen. You know, I see churches having a computer hub, just access points all throughout Brevard County, in which people can go and remain anonymous and in private, and answer these questions and get sort of an idea or that roadmap of what they need and go. And I think that, you know, we have to, from a leadership standpoint in Brevard County, to start is to make sure that this meets the needs of families, elders, caregivers, and then be sure that everybody's on board with it and get it out there and have those access points available. I mean, you can even go as far as to say maybe we should look at getting an iPod app for it. I mean, there's all sorts of things that we can do to make sure that people have access to this free service, because it's free. It doesn't cost them anything to get on it and get that game plan.
And they're going to be involved, and that's the biggest problem. It's been in my experience in working with senior programs here in Brevard County, Florida, for the last 19 years, has been to get people to believe that you can solve the problem. That it's not that difficult to solve. Once you identify the problem, come up with a well-founded solution, but you can do all those things, but if you don't have the leadership, if you don't have somebody that's got the stick-to-itiveness that says, we've got to solve it, it won't get solved.
You brought up a good point. Sometimes the problem isn't enough resources. It's the resources, or the folks with the resources not knowing who has the need, and the folks with the need not knowing where the resources are. So what the system's designed to do then is make the connection between the need and the resource. Remember the article in Florida Today last year, sometime around July or August, when it was mentioned that $28 million worth of food stamps were left on the table unclaimed by seniors just in Brevard because they didn't know they would qualify, or they didn't know how to access them. Okay, that problem would be resolved in a great part just from the use of this system.
Yeah, it makes a lot of difference. You know, and thinking about well, I think what we're going to do, we're going to take a quick break, and we'll be back in a moment. So don't go away, because when we come back, I want you, Chris, to talk about We Help Brevard.
Brevard Community College is proud to produce and air Aging with Dignity, a public service show featuring topics that affect Brevard County senior citizens and their loved ones. Brevard Community College encourages you to consider leaving a lasting legacy by investing in BCC, a nationally recognized community college that has served more than 500,000 students in its nearly 50-year history. Your gift will benefit generations of students to come and help ensure Brevard Community College's future success. To learn more about how you can donate to BCC, please call the BCC Foundation at 433-7094.
We're back now, folks, and we're going to continue our discussion about some of the innovative new ways we can improve case management for elders. Chris Stegman, we were talking before the break, and I wanted to have you sort of tie We Help Brevard and show how it can validate the senior connection and how that works. And then you, Dr. Trinnick, I want you to comment on what Chris is going to say. Go ahead, Chris.
Well, you know, We Help Brevard I'm very proud of. Where it came from was at the foundation. I would get phone calls, Joe, 2 or 3 a week from somebody in the community who maybe we were helping, or we had helped previously, or helped somebody in their church or whatever it was, and they'd call and they'd say, you know, Chris, my air conditioner's blowing warm again. Had a guy out here, you know, a month or so ago. He charged me $800, and it's still not working. I think I got ripped off. Who does the foundation have? Who do you use? Can you? And then we'd send them from, you know, the Climatic, who does all of our centers in Brevard County. I'd call the owner, Dave, and say, and he'd go over there and fix it and take care of it. plumbers, auto mechanics, lawn maintenance, pool people, all that. I would get all these phone calls, and I thought, you know, we know seniors get scammed. We know that happens, unfortunately. What can we do to try to prevent that? And that's sort of what We Help's goal is. It's sort of a safety net for senior type of issues when it comes to those kind of services. What We Help does is they go and they certify businesses like air conditioning mechanics and plumbers, roofers, to ensure that they're a reputable business. Make sure that they're licensed, they're insured, they've got workman's comp, they're not in trouble with the State Attorney General's office or any Better Business Bureau. We make sure that they're a reputable company. And then what we do is we put them through a couple of workshops to learn about senior sensitivity courses and things to look for when they're dealing with seniors and what seniors need. We connect them. And then we list them, and they're an elder-friendly business. They get certified so that when a senior citizen calls We Help and says, I need an air conditioning mechanic, we can give them a list of 3 or 4 air conditioning companies in Brevard County that we know are good companies and reputable, that the senior can call and have sort of that peace of mind and not worry about, you know, getting taken advantage of. Where the connection is with Whole Senior Connection is that we could have those elder-friendly businesses in that system as well. So as you're answering the questions, if a question comes up about, you know, are you worried about your roof or something like that, and it pops up, you know, we would have those roofers from We Help Brevard in the system, and vice versa. So again, it's about connecting the service providers in the community and making sure that seniors are not getting scammed.
Bob, in designing a system, would you have thought that you could marry up your program with the type of program that Chris describes, and the ease, and how that would make it much easier to do what you're trying to do?
Yes, because they would complement one another. We Help Brevard is phone-based, and the Whole Senior Connection is web-based. The bottom line, though, they share a common set of providers.
Yeah,
Okay.
and the providers are there. He's already identified them. So it seems to me like the piece that we haven't really plugged into this system is the medical network.
Well, I was just so moved by all the things going on here because I'm visioning these two interconnecting, because many people, once they get the list, say, okay, now how do I access it? Well, I could call We Help Brevard, who has other social service connections. And I love the name Senior Connection, because what we see are disconnected seniors. Even me, I've lived for decades in my hometown. I know who the plumbers are and the electricians, because for generations that's who we use. Then you move to Florida, as many seniors do when they retire. No idea. Who do I trust? Who do I call? I have no history here.
Right. Exactly.
But what I was saying, we've got a great great mechanical type resource, but I think and I didn't even think about it, and I should have. But a more valuable piece of this network is bringing in programs like the Perry Senior Consultation Center, and they have the Health First Aging Resource Institute. You have the Brevard County Commission on Aging, and I think that we could do a better job of bringing the medical network into this whole system.
Well, you could. One of the things we do at our office, since we're a consultative service, is people will say, I'm looking for a family doctor. Well, what do you need? Do you want somebody who's into alternative medicine? Do you want somebody who makes rounds at the hospital? Do you want somebody who has a subspecialty in maybe renal disease or pulmonary disease? And if we had that information, somebody could click on and have a good match.
Well, that's exactly what I was saying. That you were talking about the fact book, the medical fact book, something like a couple of thousand doctors listed in there, but they're just names.
Yeah.
Right.
You don't know anything about them.
Right.
Yeah, one thing with the system, for example, the doctor brought up a good point. Let's say I'm answering one of the questions, do you have trouble with your vision? If the answer is yes, the next question is, does your vision prohibit you from enjoying activities that you used to be able to do? If the answer to that is yes, then some additional questions appear on the screen which get into mobility and living with